about 30% of people with binge eating disorder have a ADHD or can be diagnosed with ADHD. So ADHD does complicate treatment. We're living in a society that promotes attention deficit disorder. This idea of structure is very important, both in binge eating disorder, ADHD, and also if people have associated depression or other problems. Some of the pharmacological approaches to ADHD and binge eating disorder do overlap. So I want people to feel optimistic about recovery. Recovery is possible. People that say it is not don't know what they're talking about.
Welcome to Recovered Space podcast, where we discuss science and real stories of eating disorder recovery. Hi everyone, I'm Anastasia and I'm the founder of Recovered Space. And I'm so excited to be back for another episode with Dr. David Garner, a leading expert in eating disorder recovery field with over 40 years of experience. Welcome back, David. Glad to have you here.
Thank you. I'm glad to be here.
So today is going to be our third episode in the series about binge eating disorder. So please make sure you watch the previous two episodes where we discuss in details different questions about binge eating disorder, the causes, the symptoms. We also discuss the differences between binge eating disorder and emotional eating. And Dr. Garner also shared with us quite a few great practical tools that can help you to break the cycle. So, and in today's episode, we're going to be talking about another very important topic, which is about co-occurring conditions and binge eating disorder. So, with that said, Dr. Garner, I would like to start off by asking you a question about possible relationship between binge eating disorder and ADHD.
Well, certainly there is a relationship between the two. It turns out that, first about 80% of people with binge eating disorder have some of their co-occurring lifetime, co-occurring psychiatric disorders. So again, it's not like people just have one problem. Sometimes they'll have multiple problems. And one of those problems which can be co-occurring with binge eating disorder is ADHD. And about 30% of people with binge eating disorder have a ADHD or can be diagnosed with ADHD. So it's not uncommon at all. And it's important to understand that. And it's important also to understand that ADHD does complicate treatment. We'll get into that a bit more later, perhaps. But it complicates treatment because people, if you're trying to give people instructions, for example, about how to overcome their eating problems, if they have trouble following instructions and listening, and if they have distractibility, then that can actually interfere with them following through with the instructions. And also if they're impulsive, generally impulsive, not just impulsive around food, then it can decrease the likelihood of them really being able to implement some of the treatment strategies that we would describe.
It's clear for me how having ADHD can make it harder for people to recover from binge eating disorder. But I also wonder how the situation when someone has a binge eating disorder and ADHD can make the symptomology of binge eating disorder worse. So how the dynamic of binge eating disorder itself can look like when someone have both of these conditions.
Well, remember, people with binge eating disorder are oftentimes eating in an impulsive way. So they may have a plan about how they're going to eat, but they end up being, kind of having a very low threshold for engaging in impulsive behavior. Well, if they have ADHD, then this adds one complicating feature, because this is a feature of ADHD, having trouble, with being impulsive oftentimes. And so this, if you already have a kind of a substrata of impulsivity, then that certainly carries over to the way you might address food. So it really can complicate the problem because you have inherent impulsivity. It's genetic, or it's something that's occurred as part of your personality. And then this occurs with binge eating disorder, where impulsivity occurs around eating. People have trouble inhibiting their wish to eat. And so in this way, certainly the ADHD makes binge eating problems worse.
Right. Before, in previous episodes, we talked a lot about causes that can lead to developing binge eating disorder or disordered eating. Is it possible that someone can develop binge eating disorder because they have ADHD in the first place?
Well, I guess I kind of resist the idea of looking at specific causes and effects because we really don't know the relationship. And we're constantly looking for a cause. I think this comes from our long history of psychoanalysis, where we're looking for kind of one cause. But I think it's important, maybe rather than focusing upon cause, to just say these are associated conditions and they complicate each other. I think that's an important way to think about it, as opposed to one causing the other. Because again, it's hard to separate out cause and effect, even with many people who, of course, as we've talked about, who have eating disorders, restrict their food intake and lose weight. Well, people can develop, through weight suppression, develop symptoms that look like ADHD. If you read the starvation study, you'll see that many of these men were pretty even-tempered, but then they became impulsive. They had trouble, tending to following instructions. They tended to have a breakdown in both their eating behavior, but also in other aspects of their life. So again, the cause-effect relationship may not be as important as understanding the interactions between these things and understanding how they complicate treatment.
Right. So that's great segue for us to probably cover this question about the treatment, like how the treatment process looks like for someone who's got both of these conditions, and probably how this treatment process and approach is different compared to the treatment process when someone has just binge eating disorder and they don't suffer from ADHD.
Well, I don't know that the treatment would necessarily be completely different. It's just that the challenges would be greater the more problems you have. I mean, in addition to this, if you have substance abuse problems or depression or anxiety, in addition to binge eating disorder, obviously this makes it a much more complicated picture. In the case of ADHD, I mean, fortunately, many of the treatment recommendations for binge eating disorder in the absence of ADHD are actually very applicable and appropriate if you do have ADHD as well. For example, one of the things that we focus upon in the Recovered Space program is the development of structure around eating. Well, structure is a very important antidote to ADHD. People are unstructured and impulsive. We're trying to get them to hone their attention in on a specific area, trying to follow instructions carefully. That may be more difficult for somebody with ADHD, but the structure around eating, and in fact, the structure overall in their life is very important as a treatment principle. And the same can be said, structure is very important for binge eating disorder, for ADHD, but it's also very important for depression. There's a type of treatment called social rhythm therapy, which involves actually increasing the structure of people that have bipolar disorder. And so if people that have bipolar disorder, if they don't eat at the same time, if they don't sleep at the same time, if their life is more chaotic, they're much more prone to bipolar disorder. Wow. And so there are many. So I think it's important to understand that this idea of structure is very important, both in binge eating disorder, ADHD, and also if people have associated depression or other problems, trying to focus one's attention upon structuring one's life, both eating, sleeping, and general one's work time, and trying to make sure that you have as much structure built in your life as possible. That can be very helpful.
Right. It sounds all great. And on paper, it sounds very obvious and very understandable why we should have structure in our life in order to not just overcome binge eating, depression, whatever else, just in order to live the life to the best of our ability. But I would guess that for people who's got these issues, this is immensely hard to put any sort of structure into their life. It can be eating if we're talking about eating, or it can be sleeping schedule or working hours, whatever, walking a dog. So I believe my question is, based on your clinical experience and experience in coaching clients right now, are there any specific steps or specific protocols how someone can start creating this structure about one specific area of their life?
I think, first of all, I think it's important to have a plan, because many people that are having with these struggles have no plan. They're just flying by the seat of their pants. And so they basically will make a decision on the fly. So having a plan is good. Obviously, people may have difficulty following the plan, but the first starting point is having a very clear plan. And once one has problems adhering to the plan, trying to get back on the horse, as it were, and trying to focus upon the plan and how to implement it. The other things that are important to try and do, maybe, is remember, we're living in a society that promotes attention deficit disorder. I mean, we have constant emails, constant texts, constant distractions. So it's very hard to have periods of time where you actually have uninterrupted concentration. So one of the things that people can do if they're prone to attentional problems is they can actually spend time trying to focus their attention without interruption. So I think shutting off your phone, trying to not attend to emails immediately. Remember, people with attention deficit disorder end up switching tasks continuously. Well, we're living in a society where multitasking is revered. Mm-hmm. And unfortunately, multitasking decreases your efficiency. So in many areas of one's life, trying to see if you can't have periods of time where you're quiescent, where you're trying to focus, eliminate distractions around you. I think this can be very helpful in general. It's helpful for people that don't have ADHD and binge eating disorder, but it is particularly helpful if one is prone to having attentional problems.
That makes total sense. I believe it's about just being intentional with what you're doing and like kind of keep promises to yourself. If you're trying to sort out some area of your life, and in our context, it's mostly about relationship with food and body and bring some structure to to the way you eat. It's not gonna hurt anyone if you just make promise to yourself, like, okay, I'll try, and it can help just make the whole process more intentional. Okay, like I'm setting intention that I will try to follow this structure. I create my plan, and you can probably expect that you're gonna slide back. But again, as you just said, you should just get back on the horse and keep going.
I think that's correct, and it's also important to understand that the principles are pretty clear about what works. The problem is the difficulty in following the principles. And so that's right. You have to be able to follow the principles when you have a backslide or a problem, being able to kind of refocus your attention on the principles. Try and change some of the ancillary aspects of your environment that might be distracting to you. But remember how we've evolved over the years. 1,000 years ago, or 500, or even 100 years ago, there weren't so many distractions. If you're working on the farm, you're plowing down the field, you're not listening to music with your earbuds. You're not trying to hold your phone in one hand while you're plowing and answer your emails and texts. So our world has changed dramatically. It used to be that people would go to bed at a particular time. Why? Because it was dark. They didn't have lights. So for thousands of years, we've evolved in a way that really promotes attending to tasks pretty specifically. Our lives were not so complicated. Now we are constantly bombarded with advertisements, messages, phones, computers, and also just the environment that we live in. We live in an environment where there are a lot of people who can constantly distract you or bug you. So I guess the practical advice is, first of all, understand that the principles of trying to structure your environment are extremely important. And that with people that have ADHD, well, they just have real difficulties doing that. They have trouble focusing. They get distracted. They have trouble following instructions. So the instructions are good. The trouble is following the instructions and continuing to follow the instructions. So, and they may be quite impulsive in general. So if you're impulsive in general, and you also have a lower threshold for binge eating because you've been dieting, well, then it takes very little energy to trigger your symptoms or your difficulties because of your impulsivity. So we really understand how to cure binge eating problems pretty well. I mean, we have, and other eating disorders or disordered eating patterns, we know how to actually address those. The problem is people complying with that. And when they fail, making sure they're not discouraged. You can't be discouraged because you have problems backsliding. You need to actually understand these are good principles. We are human beings. We're fallible. We make mistakes. And we have certain predispositions which make us more prone to making mistakes. But nevertheless, try and get back to solidly implementing the principles. That's the key.
Right. So actually, David, I wonder if there's anything you would like to share with us before we jump into another topic.
Well, okay, one of the things that I think is really maybe pretty helpful is understanding that, fortunately, some of the pharmacological approaches to ADHD and binge eating disorder do overlap. So, for example, Vyvanse, also methylphenidate and Ritalin. These are stimulants, and these stimulants are very helpful in reducing the distractibility of people with ADHD. They also are useful since they do have an appetite curbing effect, they're quite useful for binge eating disorder. Now, not everybody does well with these medications. So with Vyvanse, for example, people with binge eating disorder, about 40% of people do well compared to placebo. But also placebo, about 20% of people do well. Placebos work pretty well. Vyvanse works, quite a bit better. It doesn't help everyone. So 60% of people do not do as well, but 40% of people do well. So if you have binge eating disorder and attention deficit disorder, if you have those two problems co-occurring, then I would really encourage at least exploring the possibility of a stimulant drug like Ritalin or like methylphenidate or Vyvanse may help you in getting control. Now, again, they're important as supplements to some of the treatment principles, such as meal planning. If you're
Right.
dieting like crazy, then it's not going to make a whole lot of difference that you're on a particular medication, because you're actually producing a lot of symptoms because of the dieting, and you're increasing the likelihood of binge eating behavior. So if you're following treatment principles that we're outlining, and plus some of these medications may be very useful.
Actually, David, I have a follow-up question on this one. I wonder how doctors decide if someone really needs to, to get this medication, or someone can be fine without medication.
Well, again, I don't want to be critical of the psychotropic medications or use of them, but I think that it's in many areas of medicine, the drug that's prescribed is directly related to the pathogenesis or the nature of the causal factors that are creating a problem. So that if you have a diabetic, you're prescribed insulin because we actually know how it works in dealing with the low secretion or lack of secretion of insulin from the pancreas. So we understand how that works. Or if you have an infection, well, we know how an antibiotic actually kills bacteria. So therefore, it's prescribed, and we directly understand the cause and effect relationship and how the drug works. With psychotropic drugs, it's a bit murkier. So I think most often what happens, well, first of all, what happens frequently is people just overprescribe medication. I did a study quite a few years ago looking at the fact that a very significant proportion of people with eating disorders were on medications that were all off-label. They weren't the medications that have been approved for the treatment of bulimia nervosa, for example. So they'd be on 4, 5, 6 different medications. Well, I think this reflects kind of the frustration oftentimes with trying to look at the effect of medications and being disappointed with this. But most importantly, what happens with psychotropic medications is trial and error. So if you're somebody trying to think about whether to prescribe, for example, Vyvanse, you might look at, okay, does this person appear to have impulsivity problems that go beyond their binge eating problems? And does it appear, for example, did it predate their problems? Were they having trouble in school? Were they having trouble concentrating? Did they tend to have impulsivity problems? Did they fidget a lot? Did they interrupt people a lot? So did they have some of these symptoms before the onset of the binge eating disorder? Well, that may make it clear that this person may have a substrata of attentional problems that were actually predated their binge eating disorder, so it makes them a very good candidate for the medication. But since we also know that these stimulant drugs can be useful for people with binge eating disorder, I think that one might have a pretty low threshold for deciding to prescribe these medications as an adjunct to really good behavioral treatment. So I think, again, it's more of trial and error with many of these psychotropic medications. If one doesn't work, we switch to another one. That's unfortunately the state of the art at this point. It's more art than science right now. Prescribing medication is simple. Therapy or self-help is very time-consuming, and it requires a great deal of, attention, you might say.
Yeah.
So, and partly the economics of the healthcare system currently, at least in the United States, I mean, it's people, time is money. So people end up looking for a quick fix. Both the client is looking for a quick fix, and oftentimes the doctor's looking for a quick fix. Now that's, again, we have very responsible psychiatrists who do not overprescribe, or family doctors who are very careful about not overprescribing. But again, it's important to understand that's one of the real beauties of the Recovered Space program. You can take your time. You can, you're not on a schedule. You don't just have 1 hour and then you stop. You can go at your own pace. You can really kind of overlearn some of the principles, which may not be something that's easy to do in a doctor's office or to do in another type of environment. So I really think that's the brilliance of self-help.
Yeah, that's true. Cannot agree more. And I believe the next topic and question I really would like us to talk about is about possible relationship between binge eating disorder and alcohol abuse. We can, you tell me how you would like to go here, because we can separate substance abuse and alcohol abuse, or we can talk about them as under one umbrella. Can you please tell us a bit about this?
Okay, well, first of all, it's important to point out that about close to 30% of people with binge eating disorder have alcohol abuse problems or substance abuse problems. So it's important to understand that these are co-occurring conditions. How does this complicate things? Well, for example, in one way that it complicates things is certain medications that you might take. For example, if you're taking Vyvanse, you probably shouldn't be drinking. So if you have an alcohol problem, and you're taking a medication, there could be complications which occur because of that. And that's a significant problem to keep in mind. I guess in looking at substance abuse problems and eating disorders, I think that there's one broad, set of principles to try and understand. And that is that some people develop their binge eating disorder after their period where they began abusing substances. So it may be that they're abusing substances and then developing the binge eating disorder. Some people develop binge eating disorder first, and their substance abuse occurs later on. In fact, their substance abuse may be part of their homegrown strategy of trying to control their eating. So now, in that instance, since the drug is being used specifically to address their eating disorder, I think then treating the eating disorder really makes a great deal of sense, because hopefully a comprehensive program to assist them with their eating disorder will reduce the need for them using medications or substances to control appetite. But if people have had a long-standing drug abuse problem before their binge eating began, then one may need to really refer them, or they may need to refer themselves to an alcohol or a drug treatment program, because the drug problems or the alcohol problems really predate the eating problems. And in fact, their eating problems may in some ways result, in part at least, due to their substance abuse problems. But it's important to kind of disentangle which came first, which may be the primary problem, and are these problems fundamentally interrelated? Because if they are, then you need to really tackle both at the same time.
David, do you think that if someone's suffering from binge eating disorder and at the same time alcohol or substance abuse, it makes likelihood of having relapse like way higher compared to someone who is in recovery but doesn't have these issues?
Yes, alcohol both complicates treatment. It also reduces the likelihood that you're going to be able to maintain control during the period of follow-up. So relapsing, once you've done well, is much more likely. And again, this just makes logical sense. If you have developed a strong sense of principles for controlling your food intake and controlling your eating, you develop structure in your life, and all of a sudden you consume a drug which reduces the effective structure, it's disinhibiting in nature, then of course the likelihood of relapse increases dramatically. So again, during the period of both self-help or recovery, then I would advocate not consuming alcohol. And also for a period during which you're in recovery after you've made successful transition to being asymptomatic, you don't want to increase the likelihood of relapse, because that's just, then it's disheartening. So staying away from alcohol, staying away from drugs is probably a very, very good idea, or unprescribed drugs, during the period of both treatment and during the period of recovery afterwards.
Right. And I believe in general, staying away from alcohol and drugs is a good idea.
There are people, the thing that's really critical to point out is that there's tremendous individual differences in the tolerance for alcohol. Some people can be social drinkers for life. And in fact, there's a big debate in the alcohol treatment literature between an abstinence model and also a controlled drinking model. The Sobels have advocated this controlled drinking. Well, the reality is that some people can actually recover from alcohol problems and be social drinkers. Other people, it's a disaster. Abstinence is the only answer. And the same is true with the co-occurrence of binge eating disorder and alcohol problems. Some people at some point down the road, once they've made headway toward recovery, may be able to engage in social drinking without it having a terribly disinhibiting effect. But other people need to stay away. So this is an empirical question. There's no scientific test that I know of that allows you to determine which group you fall into. But if you find that consuming alcohol tends to make your binge eating worse, then just stay away from it.
And also, David, I would like to ask you, what are the other common co-occurring conditions co-occurring to binge eating disorder?
I think I stated earlier on, about 80% of people with binge eating disorder have a co-occurring psychiatric diagnosis at some point in their lifetime. So this means that the majority of people don't just have binge eating disorder, but they have something else going on. So we've discussed the problems with ADHD and how that affects people, also how alcohol and substance abuse affects people, but also many people with binge eating disorder also suffer from depression or anxiety disorders like OCD. So the fact that there's a co-occurring condition, it's important to really focus on the complexity of the situation. People are having depression and binge eating disorder. And again, it's pretty depressing to binge eat. So depression may be kind of a rational response to binge eating. But if there appears to be depression which is underlying and independent from the binge eating disorder, then it's important to try and focus upon treating the depression as well as the binge eating problems. So, in this sense, and again, this is important to understand, did you have depression before you developed your eating problems? Also, when you make pretty good headway with overcoming the binge eating, are you still suffering from depression? Well, if this is the case, then it's important to receive both treatment for the binge eating problems as well as depression. Because if you just treat one, it's not ideal to overcome binge eating disorder, but to be very depressed and unhappy. So how can we focus upon that? Also, people maybe, it depends upon what kind of depression they're suffering from. Is it reactive depression, or does it appear to be something that comes and goes and it's independent of precipitating events? This gives you a hint about perhaps the underlying depressive features that need to be treated.
Thank you for shedding light on this one. And it's great that you said that it should be tackled at the same time, and you should be able to somehow cover and treat and heal both of these conditions if you happen to have two of them.
But remember, there are instances where the depressive symptoms are the direct result of the eating disorder. There's two different ways in which that occurs. Number one, if one is engaging in restriction and weight suppression, we know that produces binge eating disorder and produces depression. So you can be completely normal, not have any psychiatric history or fundamental psychiatric problems. If you restrict your food intake and suppress your weight, you will probably be depressed and you'll probably binge eat. So I guess I have always approached this problem as it might be useful to unpack the problem by tackling as much as possible the binge eating disorder or the eating disorder or disordered eating first and see what the residual is, see what it is. Because again, if your depression is secondary to weight suppression, then I guess I wouldn't recommend an antidepressant because because the depression is an artifact. It's secondary to your eating disorder. The other way in which this occurs is that I think, as I alluded to before, if you're engaging in binge eating multiple times a day, if you're not depressed, you're not paying attention. It's a depressing problem. So therefore, to simply provide somebody with an antidepressant, are you going to try and make them happy binge eaters? I mean, I don't think that's particularly useful. So in general, I think the idea of being able to explore carefully whether or not the binge eating disorder is primary and whether or not some of the symptoms that you're experiencing are secondary. And if they're secondary, I guess proceeding with treatment of the binge eating problems first might make sense and see what's left over. Understanding that even in the starvation study, as you may remember, people experienced the depression not just during the time that they were starved, but during the subsequent period of weight restoration. So again, trying to treat the eating problems, getting somebody's weight kind of at an appropriate level, trying to help them control their binge eating problems and see what's left over. And then if it appears that the depression is either independent or is not specifically related to eating disorder symptoms, then of course it's worthwhile to treat it.
Right. It's actually a great framework for everyone to think about that. Thank you so much.
Parting words that I'd like to leave people with is to really understand that we really understand treatment of binge eating problems. The treatment principles are really sound. We also understand a lot about treating ADHD, and we have pretty good tools for doing that. And fortunately, the tools for treating both of these problems are similar. It's building in structure. Also, if you have co-occurring depression, we actually understand that building structure into your life around your eating, around your sleeping, this can be very helpful in dealing with depression. So fortunately, all of the problems that may be co-occurring with someone can benefit from following the kind of treatment or the kind of recommendations, the self-help recommendations that we are advocating in the Recovered Space program. So I want people to feel optimistic about recovery, to understand recovery is possible. People that say it is not don't know what they're talking about. So it is possible. We just need to make sure to implement the principles, not to get discouraged when we backslide, but to understand the principles are sound and to follow them even if you slip up occasionally.
Right, that's great closing for today. So thank you so much, Dr. Garner, for being here with me today. It's been very insightful and profound conversation. So I hope our listener is going to get as many insights as possible and not only get them in their head, but also act on them. And hopefully our app will be a big help for them to do so. In the next episode, We're going to discuss quite broad, but at the same time, very important topic about social, cultural, and family factors and how all this together can really contribute to binge eating disorder development. So please make sure you subscribe to our channel so you don't miss any episodes. And thanks again. Great pleasure as always. And see you next time.
It's great to be here.